We will discuss what palpitations and arrhythmias are, the top 5 causes of palpitations, and how we can detect, treat, and prevent them. Generally, we do not feel our heartbeat. However, if we do, it is likely due to palpitations. A palpitation is the noticeable awareness of one's heartbeat. It can manifest as a rapid heartbeat, skip beats, or the sensation that the heart is missing a beat or has a pause followed by a strong beat. Some describe it as a fluttering sensation in the chest or a forceful heartbeat, often referred to as pounding. While palpitations are sensations, arrhythmias are actual irregular heartbeats that can sometimes cause palpitations. Palpitations are subjective, while arrhythmias are objective changes observed on an ECG and are diagnosed as a heart rhythm disease. The majority of palpitations are harmless. The most common cause of palpitations is anxiety. Stress leads to the release of adrenaline, the stress hormone, which stimulates the heart, causing an increased heart rate and strength of heart contractions, leading to palpitations. The second most common cause of palpitations is caffeine, especially in high doses. Caffeine acts as a stimulant by blocking adenosine receptors, which normally promote relaxation. This blockage increases cardiac activity. That's why caffeine is not recommended for children, as it can increase anxiety and cause heart palpitations. The third most common cause of palpitations is atrial fibrillation, a disease affecting 1 in every 10 individuals over the age of 60. The most common sign of atrial fibrillation is a rapid, irregular heartbeat that feels like fluttering in the chest. Other symptoms include fatigue and shortness of breath. For diagnosis, an ECG is used, where abnormal erratic electrical activities, called fibrillatory waves or F waves, are visible. Additionally, the absence of P waves, which should normally be present, and irregular RR intervals between heartbeats are also indicators. Risk factors for atrial fibrillation include age, hypertension, and coronary artery disease. Chronic diseases like thyroid disease, diabetes, asthma, and sleep apnea also increase the risk of atrial fibrillation. Alcohol, obesity, smoking, and genetics are additional risk factors. The treatment approach for atrial fibrillation in older patients aims to slow down the heart rate using beta blockers, calcium channel blockers, or digoxin. In younger patients, the primary treatment is rhythm control to regain a normal rhythm, using medications such as propafenone and amiodarone. Sometimes, both medications are used, but monotherapy is typically sufficient in most cases. People with atrial fibrillation have a significantly increased risk of stroke because blood clots can form in the atria. These clots can dislodge and travel to the brain, causing a stroke. For this reason, anticoagulant therapy is necessary for most patients. Apixaban and rivaroxaban are commonly used as anticoagulants, decreasing the risk of stroke by about 70%. Constant monitoring and therapy adjustment are crucial, and lifelong therapy is required in most cases of atrial fibrillation. Another common arrhythmia is ventricular tachycardia, where the heart beats more than 100 times per minute and electrical signals originate from the ventricles, the lower part of the heart, instead of the upper parts, known as the atria. Causes such as cardiomyopathy and underlying heart diseases, like coronary artery disease, often lead to ventricular tachycardia. The most common signs of ventricular tachycardia are sudden rapid heartbeat that feels like pounding or fluttering in the chest. Sometimes, syncope and fainting occur because the heart doesn't pump blood effectively. The primary diagnostic tool is an ECG, which shows a fast heart rate and prolonged QRS complexes that indicate ventricular contractions. This is because the impulse originates from the ventricles, not the usual pathway. The P wave is dissociated from the QRS complexes because the atria and ventricles are working independently. Amiodarone is the first-line medication used to control ventricular arrhythmia. Treatment is crucial to avoid life-threatening complications, such as ventricular fibrillation. Beta blockers, like metoprolol, are also sometimes used, especially when ventricular tachycardia is associated with coronary heart disease. Lifelong treatment of ventricular tachycardia is often necessary. The third most common arrhythmia is bradycardia, which means a slow heart rate, defined as fewer than 60 beats per minute. Although it can be normal in physically fit people, bradycardia often has no symptoms. When symptoms do occur, they may include fatigue and weakness, general tiredness, dizziness, and lightheadedness due to reduced blood flow to the brain and other organs. Fainting spells may occur if blood flow problems are too prominent because the brain isn't receiving enough oxygenated blood. Confusion or memory problems can also arise as inadequate blood flow can affect cognitive functions. Shortness of breath is experienced particularly during exertion as the heart struggles to increase its rate sufficiently to meet the increased oxygen demand. The most common causes of bradycardia include Aging, degenerative changes in the conduction system of the heart are common as people age. Heart diseases, structural heart issues, such as heart valve problems or heart failure, can lead to bradycardia. Electrolyte imbalance, deficiencies in electrolytes like potassium and calcium can cause a temporarily slow heart rate. Hyperthyroidism, reduced thyroid function also causes a slow heart rate. Medications, some drugs used for treating high blood pressure, such as beta blockers and calcium channel blockers, can cause bradycardia. The treatment principle for bradycardia is to adjust medications if possible. If the condition is asymptomatic, it is usually left untreated. However, if intervention is required, pacemaker implantation is the solution to provide a regular heart rhythm. Sometimes, physical activity and dietary adjustments are also effective. Supplements that can help with heart rhythm health include magnesium, important for stabilizing heart rhythm. It can be particularly effective for managing atrial fibrillation. Fish oil, this can improve heart rhythm, especially in ventricular arrhythmias. It is often used as secondary prevention after a heart attack to prevent arrhythmias. Potassium, maintaining an optimal level of potassium is crucial, as both high and low levels can cause arrhythmias. Supplementation may be necessary if a person has a low potassium level. Coenzyme Q10, this can improve heart muscle function, although more studies are needed. Vitamin D and hawthorn extract, these may have a positive effect on heart rhythm, although the evidence is not yet strong.